Welcome, I'm Dr. Steve Grinstead, and welcome to my next Freedom from Suffering Now blog. Today, I have Jim Jones with Valley Forge Medical Center and Hospital in Norristown, Pennsylvania, and Jim wanted to ask me some questions and see where we go with this. So Jim, it's all yours.
Yes, Steve. Great to have you here at the ASAM conference this year, and wanted to find out, how long have you been working with Valley Forge Medical Center and Hospital?
Wow, great question. You know, back in late 2006, I was presenting at a conference in Philadelphia, and your hospital found out about it, and they sent a couple of nurses. And they came and they just were saying, oh, we got to tell them about this. So they took it back, and next thing I know, I'm hearing from Tracy Vodder. And Tracy says, Steve, how would you like to come out and train the staff? And so in 2007, I did the first staff training, and then immediately they wanted to become my East Coast Addiction-Free Pain Management Center of Excellence. You know, an amazing thing happened at that training. When I came, it was a 3-day training. And we had maybe 10 people signed up for the full 3 days, and most everybody was going to be there day one. By noon on day one, a whole lot of other staff wanted to attend the whole thing. And Dr. Sobel, the psychiatrist over there, he was very excited about it because he says, now we can operate as a team doing this. So it's been a long time. It's been a very exciting journey.
Yeah, and I have also had the opportunity to see the program from its infancy, and we've really grown it and expanded it. And I wanted to find out, what are you doing today at the conference, and what trends are you seeing in chronic pain and addiction?
Okay, today I was invited to present at the American Society of Addiction Medicine Conference. Today is the Pain and Addiction Day. Everything today is about pain and addiction. And they invited me to come in this afternoon and talk about the spiritual concepts and what it takes to build a spiritual treatment plan, and also how to look at people's trauma history and pain versus suffering. So that's what I'm doing here today.
Oh, fantastic.
And it is so exciting because a couple of years ago, ASAM, American Society of Addiction Medicine, they included spiritual in their definition. It's a neurobiologic brain disease that impacts people biologically, psychologically, socially, and spiritually. And so that means to me that each of those 4 components need to have a treatment plan. And so that's what I'm presenting today, is the spiritual piece.
Oh, fantastic. And I know a lot of our chronic pain patients have a trauma in their background, and we've included EMDR now in our treatment at Valley Forge, and we're definitely seeing some outcomes that are very positive with those patients.
One of the presenters this morning was talking just about that. She was talking about how in their program, over 90% of the people they get in with pain and addiction have a trauma history, and she thinks it's probably higher than that. They just haven't talked about it yet.
Sure.
And I have to agree, because that's been my sense too. So having a trauma resolution component is absolutely essential.
Well, we're doing that at Valley Forge, and we're looking forward to working more with you in the future. And do you have any plans coming up in the future? Your next conference or your next program?
Yeah, next week I get to do my addiction-free pain management training right in Sacramento. It's going to be the last one in Sacramento, because in June I'm closing my practice and moving south. And for those of you that check out these frequently, in the next month or so, you're going to learn much more about that.
Fantastic.
So, it's very exciting here in Baltimore. I haven't been here for a few years. It's really awesome. We're just a couple of blocks from Camden Field, where the Orioles play. It's just such an exciting city, and I'm loving being here at this conference. And this morning at the Pain Addiction Conference, they doubled last year's attendance. We had over 400 people registered, and then they had to bring in a bunch of extra chairs because a lot of people wanted in.
Sure.
So it's well received, and it's impacting. You're going to see a big change in the trends in chronic pain treatment. A lot of you, I'm sure, have seen all the hits about the opiates and how now they're talking about, let's find something other than opiates. Emergency rooms are looking other than opiates, and a lot of pain patients are getting scared. And a lot of them don't need to be, but it's at 10 to 15%. Yeah, they need help, they need treatment, they need to get to Valley Forge or other programs that operate an integrated pain management approach, which is a best practice standard for ASAM and for American Academy of Pain Management. All of the big entities say it needs to be an integrated approach with a strong cognitive behavioral piece, and I know that that piece is getting delivered great at Valley Forge. You guys are doing a great job with that. and using my addiction-free pain management system to intervene in that area. So, you know, I'm really glad we ran into each other here.
Absolutely.
And I'm also going to be letting Valley Forge post this on their site. So, you know, check out the Valley Forge site. Check out their pain breakthrough program and see what's going on in Norristown, Pennsylvania. So thanks for joining me today. And as always, onward and upward.